All right, we're going to do some foam rolling and some soft tissue recovery work using the foam roller for our lower body, pretty much predominantly for our thigh. So the first one we're gonna do is we're gonna do our quad. Now, for anything that we're doing with this, foam rolling in general, any kind of massage, you don't need to be warm for this, so you could do this as a part of your warm up, or you could do this at any point of the day if you're really sore, stiff, and you wanna break up some of that tissue. It's very good in terms of recovery because it can help improve circulation. Basically, you're kind of pushing blood around and you're kind of helping release some of the tension that's in the muscle that's built up. So the first thing we're gonna do is our quad. Anything that you put on the foam roller, you're gonna always put it in the middle. Always put it in the middle of the foam roller. We're basically going to scan from our knee to our hip. We're not actually gonna cross over the bone. So from here, I'm gonna place one leg and I'm gonna scan, again, that length from here. So this might be sore, that's okay. That's what we're probably going to expect. And after about 3 scans of going up and down, you're gonna find the worst spot, the most sensitive spot. For me, it's right about here. And when I'm there, when you're pretty sure where it is, then you're gonna floss. It's gonna look like this. I'm gonna bend my knee and I'm gonna straighten it. I'm gonna do that for 5 reps. Just breathe. If it's very tense, or if it's very sensitive, just breathe through it. And then I'm gonna scan again. Going through the whole muscle. And if you want, you can actually rotate to the side a little or to the inside of your thigh if there's more tension there. And once you find that spot again, we're gonna do another iteration of flossing. If it's very tense and it's very sore, very sensitive, there's a lot of tension there, you can go up from anywhere from 5 to 10 repetitions with this here. Okay, so that's the quad. The next one we're gonna do is your IT band. So we're gonna be on the side, pretty much just the same thing in terms of scanning and flossing. What we're gonna do is we're gonna be on our side, and this is the position we're gonna get. We're gonna come down to our forearm. My top leg is gonna support us, it's gonna help support us a little bit, and it's gonna come out in front, and that foot's on the ground. Down to my forearm, and then my foot on the bottom, my leg on the bottom, that's the one that we're gonna roll. That leg is straight and it's off the ground. And from here, this one's a very sensitive area. We're gonna scan 3 times, find the most sensitive area. And once you're there, stay there, and then you're gonna floss about like 5 reps. Just straightening and bending the leg, just like we were doing with the first one. Then you rescan. See if maybe it's moved around, maybe it's still in the same spot, that's fine. And then one more time through. Again, you can go from anywhere 5 to 10 reps. So we did your quad, your IT band. Next one we can do is your hamstring. For this one doesn't tend to be very sensitive, but if it is, you can still go work it out just like this here. So if it is very sensitive, you can just do 1 foot on the ground and just have 1 leg on. If that's not getting to it too much, you can apply more pressure by crossing the leg over, lifting yourself up onto your hands and just going from here. Just like that, back and forth. There's no flossing motion with this one here. So that's your hamstring. Next one we're gonna do, our last one, is gonna be our glute. Okay, so our glute, remember it's gonna cover the entirety of the back portion of our hip and kind of the side. So what we wanna do is that we're gonna do our right glute. I'm on my right side. And from here, if it's very tense, this is all I need to do. I'm on my hand, the other foot's on the ground, and I'm gonna make sure I go all the way up my hip, all the way down. If you're not getting much into it there, then you can cross this leg up just like this. You do the same thing. That's gonna kind of open it up a little bit. From here, if you want, you can kind of bring the knee in or out and kind of work it out a little bit if you get to a really sensitive area. Just like that. What's useful about this one here is if you have piriformis syndrome, where that muscle gets really tight, it can clamp down on your sciatic nerve and give you sciatic episodes, which is kind of shoots lightning, if you will, pinches on that nerve, sends a shooting pain down your leg. Releasing tension from that muscle can help alleviate those symptoms, provided that that's the causative factor for it. That's our lower body. So again, we did our glute, our IT band, hamstrings, and we did our quad, IT band, hamstrings, and our glutes.